morning, everyone. How's everyone doing?
Good.
Good. Second day of Can. We're surviving so far. Yeah? Okay. So I'm excited for this session. And we are going to talk about consumer intelligence for culture-driven growth with our two esteemed panelists over here. I'm going to introduce myself. I am Sheryl Daija. I'm the founder and CEO of Bridge. If you haven't heard of Bridge, we are the first DE&I trade group for the global marketing industry. Our mission has always been, even despite now this collision with politics, to help companies operationalize inclusion as a business practice for growth. And so the conversation that we're having this morning is obviously very important to us. Despite everything that's going on, we are committed to continuing to do the work. And we will keep moving forward because we think it's ever more important. So this conversation is very timely. But before we get into it, can you introduce yourself? Danielle, do you want to go first?
Sure. Danielle Koffer. I work at CMI Media Group, a healthcare agency, and I'm a business lead.
Awesome. Hi, everyone. Kerel Cooper, Chief Marketing Officer at GumGum.
Great. So let's jump in, right? So Danielle, you said you work at a pharmaceutical agency. So obviously, pharma is a highly regulated industry when it comes to which comes with obviously its own challenges, right? So how are you using data and insights to help your clients be known and empowered beyond their titles, right? So that they're people, not just doctors or medical professionals.
And I think it's just that. It's really understanding doctors. We call it white coats off. Some people don't like that terminology, or jeans moments, or I don't know, purple jeans moments, or whatever you want to call it. But really understanding what motivates doctors in their lifestyles, because they're not just professionals, they're humans. And so how do you connect with people on a more personal level? So we use some of our tools and insights to really understand. And one of the things that we have at CMI is a sports marketing unit. And the most interesting thing is doctors love sports too. You can imagine they're all about health. They're all about, so they're running enthusiasts. They're marathon runners. They love basketball. They love hockey. We have clients that actually sponsor the NHL, so HCP doesn't have to be a dry or white coats on all the time. It's really about understanding their full personalities and their lives beyond the office.
Right. And can you take that just a little bit further? So how does that translate for you, for your clients? How do you actually apply that?
Yeah. So, for example, we have a client that has a partnership with the NHL. NHL, cures cancer, and so they activate, they partner in different ways, and we have lots of clients that are actually sponsoring the Olympics or sponsoring NCAA, or we are even looking into F1 as another opportunity to bring to life their interests in new and innovative ways.
Okay. So we'll explore a little bit more there, but Kerel, let's come to you for a second. So you did a consumer survey?
Yes.
Okay. Yeah. So how did you leverage that survey that got to the root of people's feelings, right, around personalized and identity-based ads? And why do you think this consumer-first approach really kind of works for a B2B strategy?
Yeah, I'll answer your last question first. I think the approach works because at the end of the day, we're all consumers, right? Even though we work in the advertising and marketing space, and regardless of whether it's B2B or B2C, at the end of the day, we're all people and we're consumers, and we all want to have a great experience, right? And so for us, doing these pulse surveys, reaching out to consumers globally and understanding how do they feel about advertising is super important to help us with our strategy moving forward, but also to help us when we are engaging with our customer base, when we're engaging with brands, to help them reach their consumers the right way, right? And so one of the insights that we got from the survey was that 56% of those who responded felt that digital advertising was creepy to them, right? And we're all in the space, right? And so we all know what that means, right? And so when you think about targeting based on cookies and IDs, so on and so forth. It doesn't do just using that data, that information doesn't necessarily always do the job, right? We've all sat around and said to ourselves, I was just talking about this and then I saw an ad, right? Everyone, right? Or right. And so that's what that data showed us, right? And we're able to use that information for thought leadership. We're able to use that information again to educate brands on what's the best way to go about engaging with consumers to help them have a great digital experience. We also have to remember that people are online looking for content. They're not online to engage with advertising. That's not why anyone goes online, right? But advertising has a big role to play in a consumer's digital journey, right? And so we need to, as an industry, make sure we are enhancing that digital experience, not hurting it.
Yeah. And I mean, we're all multidimensional, right? So I think that's really what the survey shows and how we need to think about. I mean, as you're saying, not just a doctor, right? You're a person and you've got a family perhaps, and you've got interests and hobbies. And so how do we bring that dimensionality into what we're doing?
Yeah, and what's interesting about that point, and I love what you said, Danielle, too, about sort of the doctors and multiple interests that they have. One of the products that we've recently developed that we're putting out in market is called the Mindset Graph, right? And what the Mindset Graph does is it looks at all of our sort of historical data that we have from a contextual perspective, creative performance, so on and so forth. And we are packaging that information up for brands and agencies to help them get better at not only planning, but activating as well too. And really digging into insights, like you said, we're all multidimensional, right? We all have different interests. We're all just not CEOs or CMOs or doctors, right? We all have, different interests in sports or politics or travel, so on and so forth. And so the graph really helps our brands understand, those additional insights around their target audience.
And what's interesting about that, I just want to say, is that sometimes you can't just let the algorithms do their jobs. Right? Because I'm not an algorithm, are you? Or so I feel like that context about, I could be a different person at 9 a.m. than I am at 1 a.m.
Absolutely.
walking home.
And you want to make sure that the digital experience that you have based off of what you're interested at 9 a.m. versus 1 p.m. is different and tailored, right? Yes. So that's the journey that we're on and helping our brands and agency partners figure out.
And then there's a whole nother layer, right, in terms of, cultural, right? Yes. Your cultural fluency, and how do you layer that on top? So Danielle, it's a good segue to the next question, which is, can you share an example of where like an unconventional insight led to a successful cultural partnership, and maybe just talk about how it validated both its authenticity and ROI?
Yeah, I mean, so we have an interesting case study with our Genentech clients about using partnering with a company called BioBot to actually read wastewater results to help inform flu outbreaks even sooner than search trends can. Yes, so there's some incredible technologies out there that can help you really understand what's going on in the world. And who would have ever thought like a wastewater product could help you predict flu
I don't know. I prefer
outbreaks.
not to think about wastewater, but personally.
But we actually, in some of the results, it was so successful that we didn't even have enough money to put into the marketplace because there was a huge flu outbreak at that moment in time. And it was able to sort of predict where it was going to happen down to the geography level. So.
Yeah, that's amazing.
Yeah.
So Kerel, so what advice do you have for brands that want to show up in like a culturally authentic way and avoid missteps, right?
So this goes back to another survey that we did, right? Again, speaking to consumers, and another great data point that popped up was 49% of respondents felt that digital advertising stereotyped them or put them in a specific box as well too, right? So if you think about that, right, again, brands need to go back and think about how they are reaching these consumers, right? And not over-indexing on IDs and cookies, but really digging into who people are and giving them messaging that creates a great experience and also helps build an emotional connection, right? We're in the GumGum Retro studio, right? And before we sat down and started here, there were people looking at the viewfinders that we had over in the corner and other sort of nostalgic items that we all remember growing up with or created a great experience for us. Some of us. Created a great experience for us, right?
Right.
And that essence, I think we've lost in advertising and marketing, for the most part. And I think that's what we need to get back to, is creating emotional connection with consumers and building relationships with folks. And I think if everyone sort of takes a step back and thinks about that and executes their strategy and campaigns based off of building an emotional connection, creating a great experience, then I think we start to solve some of these problems of consumers feeling stereotypes.
Yeah. So it's interesting because so Bridge has done some research around kind of the difference between inclusion and diversity, right? And we can also now measure the impact that both of them have on purchase intent and engagement, et cetera. And what was really interesting to me is first that there is a big difference between the impact of diversity versus inclusion, right? So, and that's maybe the stereotypical piece, right? So it's not as impactful just to have diversity, right? Whereas if you have inclusion, if you see yourself in the brand, if you can experience yourself in that brand, the impact of inclusion is pretty exponential. So the initial findings showed that the impact of inclusion on purchase intent was 3x, which is basically on par with pricing strategies, which we know is always the most impactful strategy for a brand. So, to what you're saying, it's really important to be authentic, but to think about how can you do it in an inclusive way, right? Where you really are bringing in consumers to feel like they see themselves, that they're part of that brand.
Yeah, because to your point, that is super important. And now more than ever, that's what people want. They want to see themselves in that brand, using those products and having a great experience.
And just by the way, I'll tell you just one other anecdotal insight. So brands are 23 years behind the racial representation, from a representation perspective, 23 years behind the racial diversity of the United States.
23 years behind.
23 years behind. And if we continue in the way that we are, right, because the racial diversity is increasing exponentially, right, then we're going to be even further behind, right, faster. So 23 years behind. We measured against 200 brands.
And imagine that against health equity metrics, right? So clinical trials that are behind, years and years of studying diverse populations and how they impact different populations.
So we have a lot of work to do as an industry, which, I think more insights and data and helping brands understand the opportunity is where it's going to really make that change, right? So, all right, we have a few minutes left. So let's talk about, so you spoke about the, behavioral ads are stereotyping them in offensive ways. Most consumers feel that way. Or I think it's half of the consumers feel that way. So how can brands use insights like this to build more inclusive campaigns? I mean, basically what we're talking about. What do you suggest? I mean, we had a great session, right, with Joy from Saucony at Bridge 25, right? And I felt like that really captured the essence, right? She really went in to understand what the difference was of using culture, right, of creating full culture, right? And so.
So I think there's a lot of things that brands and others can do, right? I'll give you two. I think the first one is having representation in the room where you're planning these campaigns, but also giving folks the autonomy to make decisions as well too. It's one thing to have, representation in the room, But it's another thing for those folks that are in that room to feel like they can speak up and have a say in the direction of a campaign or a strategy, right? I think that is super important. And then the other piece of it is externally, representation around who you're using in campaigns or who you're working with in these campaigns, right? In front of the screen and also behind the screen, right? To me, those are two of maybe many things that I think brands can do to show up the right way, to be authentic, to engage with consumers, like I keep saying, on that sort of emotional level to build those connections.
Yeah, I think I remember her quote was not to build for culture, but to build of culture, right?
Yeah.
So you want that culture to be, represented in an authentic way with fluency and listening to the consumers, not just thinking that you know what the consumers want.
Right.
So to kind of build on that, Danielle, what metrics or frameworks do you use to provide, those kind of inclusive strategies that deliver cultural resonance and measurable business uplift?
Yeah, I mean, at the end of the day, we have a lot of data at our disposal, and it's really just about asking questions, and it's about interrogating and starting to think about what are the barriers and opportunities that people experience, like going back to like people in general. So for example, like we do a lot of interrogation around how would an HCP feel treating an underserved population? And, there is a really interesting dichotomy between, a diverse HCP and their own world and culture that they live in versus an HCP living in a diverse population and serving a diverse population. And so there's really distinctions that you have to sort of like peel the onion back and ask questions.
Tell the audience, HCP, what is that?
Sorry, healthcare providers.
Okay.
Yes,
sorry. I figured that was one.
I'm starting to get into the healthcare lingo now.
Those people that are listening are not in the book.
Yes. But it is a very interesting story to tell because in our business we have both B2B, which is pharma companies to doctors, and then we also have D2C, direct to consumer. So it's pharma companies to people, and so that it's almost like a trifecta because you have doctors, you have people, and you have pharma companies, and there's messages going across all three, and they have different needs and different motivations, and so like patients need to understand, when you get diagnosed with something, that's a very emotional moment in your life, and you have to put yourself in that position of like, oh gosh, I want to understand everything there is to know. I want to know everything there is to know about the care that I could get. Caregivers want to understand how to treat and care for folks. Then you have doctors that need to be educated on new regimes and new medications, and so it's really understanding that dichotomy. And then there's the difference in the cultural aspects. So many folks have different relationships coming culturally with healthcare and doctors and
different
access.
Levels of trust.
Yes, I mean, health equity is a real thing, and there's not a lot equal access to medication and care. Depending on where you are and who you are, and so really understanding that is critical.
How do you use? Sorry, this is not a question that you're prepared for, so
that's okay. I love it on the fly.
I'm going to throw you a curveball. But how do you use data and insights to solve against that? And I realize we could do a whole session on health equity, so I'm going to just open up the idea of it. But how do you use this data and insights to kind of solve the health equity?
Well, we have. We have ongoing surveys where we're constantly in the market talking to patients, talking to doctors, asking the right questions. And so we're constantly updating the types of questions that we ask. And I think it comes down to like interrogating the data, not just we have a wealth of data, but how do you look at it and say, what is this telling me about the people that I need to communicate and speak to? So like you can get as much data, but data is only as good as the imagination that kind of uses it. And so I really think it's about, we have tons of access to data, but it's about asking the questions of how will people feel? What do they need to know? Is it rational? Is it emotional? Is there a variance on how they're feeling at this stage in the journey or this stage of the journey? So there is an art to, it's like that we're not algorithms, we're human beings. And I don't think there's a science to really get to know how you are, throughout a day. So you really have to listen and interrogate.
Yeah. have anything to add?
Yeah, no, I think that's a great point. And at the end of the day, to what you were saying, Danielle, right? You got to have conversations with people to understand how they're feeling, what they're interested in. And it has to be a consistent approach to it, because how you're feeling and what you're interested in today, 6 months from now,
Might
9
change,
months from now, is going to be totally different.
Or a couple of hours later
Right.
when you're tired
Right.
versus
Yeah.
when you just had a cup of coffee.
Right.
Yeah, relevance, right?
Yes.
Okay. So we're going to do some rapid fire. Okay. So I'm going to start with you.
Okay.
So what would be the one thing that you would want the listeners, audience to take away from this conversation?
Have consistent conversations with your target audience, with your consumers. Again, to understand how they feel, what they're interested in, feedback on your product and services.
Mm-hmm.
And again, it's not a one-time thing. You have to figure out how you consistently do that, and then use that information to inform how you're going to better service your consumers and provide a great experience.
I mean, I think I said it a few times, but like, we're not algorithms, we're people.
Yeah.
So there's like, we have to get back to humanity sometimes in the world of technology and data. We're humans.
So I'm going to add to that. So one of the things that we think about, is that you're kind of talking about it at a very, kind of the level of advertising and media, right? And when we think about it, we actually think about it from a business perspective. So even like maybe one level up or a few levels up, which is you have to think about your entire kind of, the entire organization, right? In terms of, it's not just how you're going to how you're talking and communicating to your consumers or your B2B, right, audience, but it's the product that you create even before you get there, right? And so how can you be intentional about creating product as well as then how you communicate, right? How do you use insights and data, even with health equity, right? How do you create products that start to level the playing field for equity? And that's with any product, right? How do you put inclusion at the center of product development? And then when you're starting to layer these insights and that cultural fluency against that, it becomes an even more authentic conversation and story.
Agreed.
Yeah?
Yes.
Okay. Well, thank you very much
Thank
for
you.
being here with
Thank
us
you.
this morning. The view here, just for those of you that might not be here with us right now, it's just incredible. And so thank you for having us in this beautiful space that
Of course.
GumGum has.
Yeah.
We appreciate it.
Thank you.